One of the key findings you need to be able to spot on an ECG is heart block. Here's how to spot each of the three types. When it comes to first degree heart block, this is defined by a longer than normal PR interval. Normally the PR interval is 120 to 200 milliseconds, but in first degree, it'll be greater than 0.2 seconds. In second degree, there are two types. Starting off with type 1, in this heart block, the PR interval is also prolonged, but it gets progressively longer and longer until a P wave is no longer followed by a QRS. So that's Mobitz type 1, but in Mobitz type 2, you do have a long PR interval, but it actually doesn't change length. In this type, there's also more of a pattern to it, so you sometimes might hear it being called 2-to-1 block or 3-to-1 block, and this is when you've got a ratio of 2 P waves to 1 QRS. Finally, third degree heart block. You might hear this being called complete heart block. This is because there's no association between the P waves and the QRSs. If you drew a line for every P wave and QRS, there's going to be no link between the two. They're going to be regularly spaced out, or sometimes the QRS might obscure a P wave because they're not communicating with each other.